Day 3 Clinical Task. Mr. Tigorov is in isolation. The nurse informs you that they are waiting for laboratory tests to confirm the diagnosis, but they suspect he has a type of surgical infection in a leg, that is clostridial myonecrosis, which is spread by spores resulting from axe injuries. She instructs to use isolation precautions and emphasize the need for good hand washing several times. The questions: why is good hand washing important? Good hand washing is crucial to prevent the spread of infection, especially in a healthcare setting. Proper hand hygiene helps remove germs and bacteria from the hands, reducing the risk of transmitting them to patients, other healthcare workers, or oneself. In the case of Mr. Tigorov, who is in isolation with a suspected surgical infection, hand washing is essential to prevent the spread of the infection to others. Will you use an alcohol-based hand cleaner? Why or why not? In the case of clostridial myonecrosis, alcohol-based hand sanitizers may not be effective against spore-forming bacteria like Clostridium species. These spores are resistant to alcohol-based sanitizers, and therefore using soap and water for hand washing is recommended to ensure proper removal of spores and bacteria. What are the modes of transmission for these organisms? The mode of transmission for Clostridium species, including Clostridium perfringens, which causes Clostridial myonecrosis, is through contact with contaminated soil, feces, or spores. In the case of Mr. Tigorov, who likely acquired the infection through an axe injury, the spores from the soil or environment may have entered this wound and caused the infection. How might Mr. Tigorov have acquired this infection? Mr. Tigorov likely acquired the Clostridial myonecrosis infection through contamination of his wounds with spores from the environment. In case of traumatic injuries like axe wounds, especially in outdoor settings where soil and environmental contaminants are present, there is a risk of introducing spores into the wounds. Clostridium species are commonly found in soil and can cause infections when introduced into deep wounds or tissue injuries.